happy to be here talking about DHIS2 for logistics. My name is Brendan Horst, and I'm the LMIS tech lead at the HISP Center in University of Oslo. All right, so I have 45 minutes to get through actually quite a bit of content. I tend to get a bit excited and speak very quickly, so I'll try to be concise and to the point. And I'll go through a quick background. For this, I will be very brief, and you can have the slides, and there's a lot of content already on this background, and also links to additional information on what I'll be presenting there. And then I'll go through some slides on monthly stock reporting, which I think is the key here, the key message, and what I'll try to be conveying to everybody on what can be done with monthly stock reporting as a first step. Then transactional stock management, as Mohammed mentioned. So that's capturing real-time data, transactions at facilities. And then a tool for cold chain equipment management as well, all right? Those are three quick overviews, and then I hope to spend most of the time on a demo and analytics, where I'll show you where you can go in, both to our demo instance and going through the workflow for capturing data, and then some analytics that we've already configured to see what you can actually get out of DHIS2 for this logistics use case in a limited sense, in a specific sense, which is last mile, also mentioned by Mohammed. So I'll go through that, and I'll finish off with some implementation considerations, all right? So maybe first, how many of you here are working with or have responsibility for logistics or stock data, equipment data? I know there's already been mentioned. Anybody, just put a hand up if you have any kind of responsibility, engagement, interest in logistics and stock data. Okay, so quite a few of you. How many of you are very, very happy with your current system and current information system for logistics? Put your hand very high up. Okay, fewer hands. All right, so this is also very common, and what I'll try to then convey during the presentation is how you can leverage DHIS2 to meet very specific requirements, but also show some limitations, and where we then recommend an integration approach. So then I think it's a good segue to our background here, which is showing the HIS landscape. This is a World Bank 2022 report, which had this mapping showing the broader HIS landscape, the different needs and requirements, and how DHIS2 and other tools meet those needs. So along the top, you see health services, medicines and supplies, human resources. And then on the left, you see your different specific tools. Not exhaustive, of course, but you see how DHIS2 takes up a lot of space. And if you look at specifically LMIS in the green box, it's kind of split between DHIS2 and other tools. And this is a general characteristic of the landscape today. And what we then try to build on this and show is that with the existing DHIS2 infrastructure, with the investments, with the know-how, with the experience that countries have in implementing DHIS2, specific features can be used, can be leveraged to then capture stock data in an effective way. Of course, it doesn't help any individual country that it's been implemented this broadly, but in the specific countries where it's implemented, you have competence and know-how to be able to use it for the logistics use case. Also, as additional background, that we've been referring to specific documents that provide standards and guidance on logistics information systems. And the key one is the Target Software Standards, which was recently reviewed and updated by the Interagency Supply Chain Group, a group made up of Global Fund, Gavi, and many other partners, which really sets key guidance for these systems. So then on our website, we have a link to this document where we went through the specific capabilities that they're requiring for an information system. And then clearly identified, if you see on the right-hand column, and you can access this file and go through it and see DHIS2 capability, either that we meet the requirement and we have it in green, we partially meet the requirement in yellow, or we don't have that available and we put it in red, to be very specific of what we can or cannot deliver, or can deliver in an integrated implementation. So on the first line there, master product data. We clearly saying we cannot function as a master product list or master product catalog, because the requirements for that at a national level for it to be used by multiple systems cannot be met within DHIS2. whereas for other specific cases, then it can be met, all right? So I think this is a very good first step to define what are your needs, what can DHIS2 deliver, partially or fully, and then to then set out on what can be implemented. Now, based on those requirements and based on the guidance, we have a very specific last mile solution focusing on health facilities and service delivery points, focusing on stock management, cold chain equipment management, and a few other things which I'll get into. And this is the last slide then on the background. Again, I'm going through quickly because I've already presented this before. We have a lot of content already backing up this information, but we look here at a very generic representation of a health structure. And on the left side for the logistics information that we focus on community health worker, hospitals and health centers, digitizing data and making use of data at that level. And then for central level, regional, and the supply chain and distribution down to the last mile, that we recommend using a dedicated LMIS or ERP. And I'll get into the reasons for that. Also why we don't necessarily have the LMS all the way down to the last mile, while leveraging DHIS2 is an advantage, all right? Now for monthly stock reporting, and you will hear me repeat this again and again. This is really a powerful way of digitizing facilities, getting data from the last mile into the supply chain to actually fix and improve stock availability, reducing stockouts, and actually providing some impact to the supply chain management. I think many of you are familiar with these tools here, stock cards and bin cards. This is the most commonly used tool at facilities to keep track of items. Either at the bin card level or a stock card, you have the quantities that are being received or issued that's tracked on paper. And if done properly, which generally it is, we find that it is, can be very, very effective at the facility level. But when you're looking at a system level, you're looking hundreds or thousands of facilities, for this data to actually inform resupply, for this data to be useful at a higher level, it needs to be then shared and aggregated. And from the paper tools, it's very difficult to have that timely access to data, which is why we recommend strongly to have that then digitized within DHIS2 and for it to be made available for decision makers, either at the facility, at the district, all the way to central level, to quickly have your quantities for stock received, your stock distributed, stock on hand, stock corrections, to have that national visibility. Really a first step to digitizing facilities, which in large part are very much paper-based. I'll go through the analytics and show how very key indicators and decision-making can be done from this very simple data capture. All right. We've worked with a few different organizations and countries, and what we often see is that the quantity of data being collected, the disaggregation for any one of these fields and additional fields, often this list becomes quite large. The data set just continues expanding, and the burden of data capture for health workers increases. So then what I'll also try to highlight is how very key data can improve the stock replenishment and stock availability. So current stock on hand, and then the average demand. What is your average monthly consumption? With those two being key data points. And those are only two data points. We're not asking about disaggregation, about stock losses, expiries, how the stock was damaged. I mean, those are important data and they need to be reported on. But this is the actual key data that will inform the resupply and can actually improve the stock replenishment, fixing stockouts and not simply counting the number of stockouts. If I go back to the data set, we don't have stockout days here, which is a very common request. I know I'll get that answer or that question very quickly when we go into the Q&A. But we can add it and it can be reported on. But the key thing is how can this data inform the replenishment and actually reduce stockouts, not simply reporting on the number of stockouts. So fixing the issue at the root and not simply reporting on what those symptoms are. So I'll get back to the stock reporting. But now I'll go into the transactional stock management using Tracker. So this is a new tool that was released with version 40. So now this is using native DHIS2 features. It's not an additional app. It's entirely native, providing the ability to track every single transaction. It has a specific workflow for Android. So we're using Android only for this program. And there you see a screenshot of it, and I'll go through a quick demo in a bit. And it supports barcode scanning. And from version 41, so the latest version of DHIS2, you also have the offline analytics and the line list, so you can have a fully digital stock card. You can do away with your paper-based stock cards, your bin cards, and simply use the tracker to manage the transactions and then have a digital stock card. For that, we're also using the data exchange, what Jason showed yesterday and demoed, to then aggregate this data and have your monthly reports to meet your reporting requirements as well using this tool. Much more advanced. I will show how it's done in a quick demo. But again, first step, aggregate monthly reporting, and then where relevant, we then recommend to improve to this type of tool. Here you see the three different workflows that are currently supported. So it's distribution, which the vast majority of transactions are distribution, but also the ability to discard for any damaged or expired goods, but also make stock corrections if there's been any errors. So those are the three different workflows, easily identifiable with the color coding, which you're able to then conduct at a facility. Now, the third then feature, which I'll demo these in a minute, is the cold chain equipment management, also using tracker, fully native features, no need for any additional apps or additional requirements. Now, this is a tool then used to manage and update cold chain equipment inventories. You can capture from the point of installation, logging alerts, and any type of maintenance that you conduct. You can track all of these all the way to the end of life or decommissioning of the cold chain equipment. We've integrated it with the WHO PQS catalog to facilitate when you register a new unit, these attributes are already included. And we have specific intentions with this, and it's to provide informed decision-making. So when you're distributing vaccines, you see the number of devices that are functional in a specific site, the storage capacity, and what you're actually able to see that the facilities have in terms of cold chain equipment. Strategic planning and purchasing, rehabilitation, replacing old equipment that you have overview within districts and even countrywide of the equipment available in that country, and to support, again, equipment inventories. Here's a quick just screenshot of logging alarms. So this is alarm counts in specific districts, and quickly you can identify where you have more or less performing equipment by district. And this same model can be used for biomedical equipment. So tracking, registering, tracking, and managing biomedical equipment in a hospital setting or really any other type of asset using the same tracker model. All right, so that was quickly going through a background, using DHIS2 at a last mile, registering and reporting on monthly stocks, the transactional stock management, and then the biomedical equipment management. So I'll quickly jump out of the presentation and I'll show you where you can go to our website. And we both have a walkthrough on the website, so you can quickly do this without needing to download the Android app and having to connect to a server. You can navigate to dhis2.org, to the logistics section here. And on the main page, you will have a lot of information, the background which I shared with you, but just down here, you'll see a walkthrough, show me how to use this use case, and a tutorial for the different workflows, all right? So here, you're in the shoes of a storekeeper or a pharmacist at your city's central hospital, and you're going to use DHIS2 to manage some stocks and cold chain equipment. You log into your Android app, and here you can keep an updated record of stocks and equipment. All right, so we're going to quickly go through the real-time stock management tutorial. I'll show you just part of it, and the rest, the other workflows you can actually do on your own. So I just choose the real-time stock management tool. And here you have a scenario which you can walk through. You start your day at the and you have your pediatrics department requesting you for some medicines and equipment. And this is the exact workflow on Android Capture. It's really just screenshots of what you would be doing on the device, all right? So once you open, you can navigate to the real-time stock management tool. You see there in green, and we open that. As I showed, there were three different workflows for distribution, discard, and correction. Distribution is by default selected. It's the most common transaction. Also, the facility where we're working is automatically chosen. And we simply choose where we're going to be distributing these goods. And we choose the pediatric department, which gave us the request. Now you quickly see a list of all of the different products which you have available with the current stock quantity. So this is up-to-date stock quantities. And the first item we're going to issue is the cefixime. And we want to issue 100 units of that. We see it's the first on our list, so we easily identify it. We have 7,000 units in stock. We choose the quantity. We enter 100, and you actually do that on your keyboard and on your device. And we click the validation check mark there. All right, so then we have our stock was adjusted from 7,000 to 6,900 immediately, and the quantity being issued is 100. For the second item, we're going to use the barcode scanning. So this is the second way that you can actually issue. So we choose the barcode scanner there at the top right. You open the camera on the Android Capture, and you scan that barcode. And once you scan that barcode, the item is immediately brought up, and you see we have 9,600 units in stock. We want to issue 150. Again, we click on the validation. We see that our stock has been adjusted to 9,450. We're issuing 150. And that's our second of three items. Now for the last item, I want to simply scroll through my list. So I click and empty the search bar. I get my full list once again. In a facility where you have maybe 50 items, it might be impractical to scroll through. So you're either using the barcode scanner or search. But here we have fewer items. I see that the face mask is my last item. I have 40 in stock. I want to choose 3 of them. I click on the 3 there. And I have my 3 items there listed with the adjusted stock. Once I've picked those from the shelf and I have them laid out on a table in front of me, I'm about to issue it to the department. I click on my review button. There's the review of everything being picked and the quantities. That's correct. I click confirm, and that's immediately registered. So I have just conducted, with a few clicks, scanning or searching, issued all of these items. And once I synchronize my device, that data is available on the server. And in case of an integration with a central system, it can also give the direct quantities. If I happen to go through below an order level or even to zero stock, I can generate an immediate replenishment. In the case of an integration, not saying that this is done automatically within DHIS2, but it's the ability to have this real-time data using this tool. Now, there are a couple other workflows which you can go through here as well for stock correction and discard, but I'll let you go through that on your own and just see how that can be done. It's even less clicks when it's for those different workflows. And the focus really is on making that process of issuing and managing transactions much easier for the health worker at the facility. All right, so that was the real-time stock management tool and that first step. Second, I'll go through one more workflow, which is the cold chain appliance inspection. So this is for the cold chain equipment. So we'll choose that one here. Now, this is for managing freezers and cold chain equipment, capturing if it's functioning, if there's any need for repairs and so on in the different stages, which I mentioned. I'll show you all the ones available there that we've configured. In the same way, you go into your Capture app. We choose the cold chain appliance lifecycle management program. And here we have a list of all of the equipment or all of the cold chain equipment installed at our facility. Here we want to conduct an inspection of refrigerator number 2, which we see there, refrigerator 2. We click on the drop-down, and we get a full set of attributes that have been configured for that device. Some of them were already integrated with the PQS, so the PQS code and category, type of appliance, manufacturer, the energy source, also the storage capacity, and so on. And all of these attributes can be configured and added as needed for reporting. So we'll just go back into our refrigerator number 2. And here we see all of the different stages that we've configured, from transferring or installing the appliance. Those are the first 2 there. Conducting a manual temperature recording, so you have that within the system and not simply recording it on paper. The inspection, which we'll conduct in just a minute, but also conducting preventive maintenance, monthly maintenance, registering appliance alarms, which is another WHO requirement for this type of equipment, that all alarms are registered. Conducting a repair request. Any corrective action or any kind of repair that has been made can be captured there, all the way to the disposal of the device and the end of life. So now we're going to conduct an inspection. So this could be a daily or weekly inspection, simply showing if the appliance is functioning or not. So we click to open that and create a new event. We add new. We confirm here the date. We conduct the inspection. So we look at the equipment and we see, is it functioning? Is anything damaged? Is it on fire or not? And once we've conducted the inspection, which may take just a minute, we click yes, inspection complete. We see that the progress bar has increased, and then we confirm functional or non-functional. And here the equipment is functional. Very simple. We save that, we complete the event, and that's immediately logged. All right, so once this is done for all of the equipment that's registered, you have a very clear and up-to-date picture of how much equipment you have that's functioning or non-functioning within the country. Same for the alarms and alerts. And you can build then analytics on that to have a clear overview, not requiring to do a manual inventory each time you want to see the status of your cold chain equipment. Similarly, we have another one. I don't have the workflow configured here, but just to talk through it, the cold chain appliance repair request. So any facility can create an event to request repair. So you need specific repair. For example, the compressor on a fridge may be broken. Your vaccines are in danger. You make a repair request. You can add images. You can write what the issue is. And at a district level, where you may have a specialized cold chain engineer or technician, they can have a line list of all of the repair requests from the facilities with a description and images of what the issue is. And they can plan their rounds to conduct any kind of repair or maintenance that needs to be done in all of these different sites which they have to travel to. So this is the type of workflow support that we want to build into this tool to be able to have visibility and also this kind of operational decision-making and work planning, in addition to the strategic decision-making with the repair and rehabilitation of the equipment. All right. So this is for the cold chain equipment management. And for that, you also have the weekly preventive maintenance. And as I mentioned, for the real-time stock and also for these, you can go through these workflows without needing to download the app and logging into the instance. Simply using the web, going through the website, dhis2.org/logistics, and demoing that, going through the exact workflow that you would be doing otherwise with the app. All right, now moving on from this, what can we do with this data that we're recording? Now, what I want to show now is just the dashboard. Now, this is yet another instance which we've created with some demo analytics, and we have quite a bit of dummy data for most of the visualizations here, but there's very often requirements for reporting on the data that's being collected. And we have this request for real-time data and having up-to-date information. So what I want to just quickly show you is what we have on the demo website for the logistics. So we have a dashboard for CCE, so cold chain equipment. And here think I have to log in again. Okay, great timing. Let me see if I can access our development instance. I think the timing of the backups and so on don't match the time zone we're in now. Okay, let me see if this one is working. 1 second. All right, this instance is up at least for now. I think it will also start restarting or backing up soon, so we'll use it while we can. So on the other instance, it's a public instance. The login and password are on the front page. As soon as you reach that login page, you'll see demo and the password, so you can log in and go through pretty much all of these same dashboards. So just to quickly show you what you can see here, it's the cold chain equipment dashboard. And here you have multiple visualizations that can be built using what I just showed you, the cold chain equipment management tracker program. And this is when you capture data, you can actually show that temperature data, you can actually show that on a graph and have this kind of information and report. We don't have nearly as much dummy data developed. It's a lot of data that we need to produce for these visualizations. So that's not as complete for the cold chain. But you can see different alerts and thresholds, inspection reports, and the number of equipment that's functioning or not functioning. Specific request we had also just at the end here is different donors that have provided different pieces of equipment. So you have the count by organization and where that equipment is currently being used. So you have quite a good overview of the different analytics that can be made with the cold chain equipment management. Now, second, and here we have quite a few visualizations. It's the monthly stock report. So we have district level analytics, monthly stock report, health facility level, provincial level, and national level. So if you go through these different dashboards with monthly stock report, you can quickly see what you can do with simply reporting your monthly stocks with those few data points, which I showed in the beginning. Still using your stock card and bin card, but having that monthly stock in DHIS2, you can quickly see your stock availability. So for this facility that I'm in, I see that 92% of the items that I have are currently in stock. I can see that that 8% represents these 4 items that are currently out of stock. Very quickly, I see and identify issues that I have to treat immediately. You're not simply reporting on the stockouts. I mean, you're doing that as well, but then you can identify which items I need to immediately replenish if I want to continue providing services. For that, I see here for September, for my stockout, I have my infusion set is out of stock, permethrin, adhesive tape, and tongue depressors. Okay, so a couple of those are not crucial, but important items to replenish if I want to continue providing a full set of health services. Here for my stock availability, I have also a comparison for the last 12 months that my stock availability was a bit low, but over time it's improved. And you can see these trends on how the performance is for your stock availability and how you can quickly both report, but also provide operational information to correct the issue where needed. You can look at how different items are affected. Here you've had for your vaccines, measles vaccines, we've had 5 different instances of stockout within the last 12 months. And this is really showing performance over 12 months for the stockout. You also have stock coverage time distribution. So from stock out to overstock and different amounts of stock coverage. So you have 0 to 1 month of stock for 8 items, for 5 items, 1 to 2 months of stock coverage time. You see how well that is distributed across all of the different items over time. And you can also quickly identify that perhaps for my items with over 3-year stock coverage, I need to maybe redistribute that, move it to a neighboring facility that maybe is understocked, and that way optimize the stocks that I have available. Multiple other things. Here you have coefficient of variation. This is just showing the variability of their demand for any one product. Is this a constant request or very stable with low to medium variability? Or do you have high variability for a single item here? And for any of these that may be a bit more complex to understand, we can show details. This is something which we saw also in the visualizations and analytics session in the first day. Of course, problem loading. We have here, you can open the details, and this was working just as soon as the instance is back online, you'll be able to see an explanation of what this means. So it will explain how the variability changes from item to item, and that for items with high variability, maybe it needs to be investigated why that is. Could it be due to a seasonal issue where it's being used more in the past few months than in previous months, or to some kind of supply availability? But for any one of these, you're able to open up and have a detailed explanation of each one of these different charts, how they can be used and interpreted, and how they can support actual decision-making for the supply chain. Further down, you have more detailed information then. This is the actual raw data being collected for the stock received, distribution, and so on for each specific item and for the past few months. All right, so this is just specific key indicators and visualizations that can support both reporting and decision-making. This was health facility level analytics. And if we look at visualization library, 3 minutes. All right, so we can actually go through really a very, very extensive list of possible visualizations that can be built simply with monthly stock reporting. So here we have section 1 with stock data, and there are 7 different sections with different types of visualizations and data that can be shown with the monthly stock reporting. Everything from stock availability and multiple variations on each one of these different indicators and visualizations. Lastly, maybe I can show the district level, which will then have, let me see here, district level here. Now we went from the facility level showing the stock availability by item. I can also see how here we've limited our district to only 4 facilities. We can see that within that district, we have 13 stockouts across the 4 facilities. I can see which of those facilities have stockouts. I can identify which items those are, and I can plan for a redistribution. So for a facility with an overstock, I can move those to a facility with understock or stockout and quickly remedy that problem. So we're looking not only at reporting aspects, but also operational aspects to reduce the amount of stockouts. Due to then the limited time, I will share this in the links to both the tutorial and the walkthrough, as well as the demo instance are available in the presentation. But I think I will then use my last few minutes just to go through some implementation considerations, all right? Just to move into presentation mode here. So to start, what are your stock data needs from facility level? Are you looking to have detailed data from a few sites? Do you want to have the transactional data from high volume sites? And that may be the case. Or are you looking for key data? So having the stock on hand and your consumption levels in order to remedy and improve stock availability. What are you looking to identify and actually fix within the overall supply chain management? I think that's a good first question to ask. Secondly, what capabilities or what capacity do facilities have to use separate systems? Are they able to manage simply the stock reporting, and that may be the case, that they continue to use their paper-based tools, which they're comfortable with using and they're familiar with? Can they move to a transactional system using DHIS2, as I mentioned, with the stock management tool? Do they want to have a full-fledged ELMIS with all of the different implications that that entails? And the answer may be yes to any one of these, depending on the context, but it's very important to identify what is the capacity within the facility to implement the same system or a separate system or a new system in order to capture that data that you need. Then what is the objective of that implementation? Is it reporting to donors the number of stockouts, or is it actually improving that stock availability and reducing the number of stockouts? It's likely both and more. What are the requirements that you have, and how is that linked to operationalizing and improving the management? How is DHIS2 fitting into this overall landscape with these needs that you have, the competence you have within your teams to be able to implement any one solution and actually sustain that over time? So looking at a total cost of ownership, how much will it cost to actually implement and maintain that system and keep it running over time? Also, I mentioned just now total cost of ownership and sustainability, but what is the holistic approach? Is this targeting a single program, which may be how it starts, perhaps only for immunization and for vaccines? But what is the possibility to expand that to multiple programs? And a lot of the approach that we're showing here, it's looking at holistic supply chain management, not simply targeting one or another program, though it may start that way, but we're really looking at having a data set from the monthly stock reporting to the real-time stock tool to capture data for all products that supply chain teams can look at those in a holistic manner, not limited to a single program. And then lastly, what are the limitations for DHIS2 for logistics management? We're not recommending it as a central medical store or transport management or for procurement. It's really digitizing that last mile, connecting it with a central management system, being able to provide strategic and tactical and operational decision-making to improve that level of management at the facilities. All right, so very clear and defined scope of implementation. Last 3 slides. So overall outcome, improving supply chain management. How are you actually improving the availability of medicines to then improve the overall health outcomes? How are you using the stock data and comparing it and analyzing it beside health data to be able to improve the overall health program management? And then lastly, and this one we can also take offline and in the breaks, how did we fit in with all of these other tools? Here you see just a few of them, just 8 different ones mentioned, but there are actually hundreds out there. There's no lack of tools or features available. The ability to successfully implement them at the last mile at health facility is the key issue that is being faced. It's not the quality of the tools, it's the ability to implement them successfully over time. All right, so thank you very much. Please feel free to come speak to me in the breaks. I can share all of this information and more, and then have individual discussions on what your needs may be and how you fit in to this DHIS2 for logistics approach. All right, thank you very much.
Thank you very much.